You awaken once more. Tonight is the third time. You've lost count. Fourth, perhaps. Like an incessant alarm, your bladder yells at you. It's hardly a trickle when it eventually arrives after you shuffle to the restroom in the dark and wait. Feeble. It's disappointing. As if your body had forgotten how to do a function that it had been doing on autopilot for 60 years. Knowing that you'll be up again in an hour, you return to your bed. Even if your wife is silent these days, you both know that your energy has diminished, your sleep is disturbed, and something that once worked flawlessly inside of you is now working against you. Growing older isn't the only factor here. This is about a walnut-sized gland that is wrapped around the tube that conducts your urine. The gland is becoming bigger every week, pressing tighter like a wet sponge, making your days into a never-ending quest for the closest restroom and your nights into a tiresome ritual, your prostate. And it's agitated, furious, and getting out of hand right now. What practically no one tells you, though, is that what is happening isn't inevitable. Age isn't the only factor. There is a certain process involved, and it is reversible. A fruit that doctors advise against due to its high sugar content has substances so potent that they can begin lowering inflammation on the first day. Not some hundreds of dollars worth of prescription drugs. It's not a drug with terrifying adverse effects. Something organic. You may find it in any market. Something supported by contemporary research that has been in use for generations. I'll show you exactly what it is, how it works, and what else you need to do to get back your nights, your comfort, and your confidence if you give me a few minutes. Picture your prostate as it was in your youth. Quiet, little and smooth. You never gave it a second thought as it sat there performing its job. However, after 40, something changes. Hormones fluctuate. Inflammation begins to develop. The little gland begins to swell. Imagine a sponge that absorbs water, grows, and presses against everything in its path. Urine travels down a narrower tube from your bladder. The flow becomes less strong. You exert more effort. You hold off longer. You also realize that you haven't truly finished when you're done. Urine is still within, accumulating, and will likely wake you up again in an hour. Benign prostatic hyperplasia is the term for this condition. Since it's not cancer, it's benign. However, the way it degrades your quality of life is not innocuous. Every night turns into an endurance challenge. Any lengthy drive turns into a stressful experience. You mentally map out the locations of the restrooms at every conference, movie, and dining out. Additionally, the residual pee can lead to kidney damage over time, infection, and stone formation. Your body is communicating with you, but it is no longer whispering. Allow me to present Robert, who is 68 years old. In the past, Robert slept through the night, used to travel carefree. He felt like himself once. 5 years later, however, everything was different. He would wake up 4 times a night, occasionally 5 times. He would stand there for what seemed like an eternity because his stream was so faint. He experienced haste and pressure, but hardly anything came out. His physician prescribed tablets that block specific enzymes. Robert, however, studied the adverse effects. Dysfunction in sexual relations, decrease in desire, depression that occasionally persisted, even after the medicine was stopped. Already he was feeling less of himself. He wished to avoid further losses. Robert then began searching for an alternative. At that point, he discovered that his prostate was being attacked daily by 4 unseen entities. There are 4 factors that the majority of guys are unaware of. Dihydrotestosterone, or DHT, is the first force. Using an enzyme called 5-alpha reductase, your body transforms testosterone, the hormone that gives you a sense of strength and vitality, into DHT. DHT is a considerably more potent form of testosterone on steroids. DHT also functions as a garden fertilizer in your prostate. It causes uncontrollable cell growth and multiplication. Your prostate expands more quickly the more DHT you make. Those drugs that doctors recommend, that enzyme is blocked. Additionally, they block things that you do not want blocked. Chronic inflammation is the second factor. Your prostate is enlarged, irritating, and inflamed in addition to growing. And the source of that inflammation is everywhere. From the decades-long sugar you've been consuming, from omega-6 fat-rich vegetable oils, From daily stress that raises your cortisol levels. From poisons found in processed foods and plastics. From your diet's deficiency in omega-3 fatty acids. Like a slow-burning fire that never goes out, everything is convergent on your prostate. Insulin resistance is the third force. The majority of men believe that insulin only regulates blood sugar. However, insulin is a growth hormone as well. Consuming sugar and refined carbohydrates throughout the day keeps your insulin levels high, which in turn tells your prostate to keep growing. It's similar to continuously applying fertilizer to a plant. This explains why men with diabetes have bigger prostates, more problems, and worse urine symptoms. The issue is being exacerbated by the sugar you believe to be harmless. The fourth force is estrogen dominance, which most men are surprised by. Yes, but typically in trace amounts, men also have estrogen. However, around the age of 40, your estrogen levels begin to rise while your testosterone levels begin to decline. Why? Because the enzyme aromatase, which is found in the belly fat you've been gaining, changes testosterone into estrogen. Estrogen levels increase with abdominal fat. Additionally, estrogen causes your prostate to enlarge. Additionally, it inhibits testosterone receptors, which means that even your testosterone cannot function. In addition, environmental estrogens from processed foods, plastics, and pesticides build up in your body and function as extra estrogen you didn't ask for. Introducing 70-year-old Carlos. Carlos carries an additional 40 pounds around his belly, has high blood pressure, and type 2 diabetes. He has a greatly enlarged prostate. His PSA, a test for prostate health, is high. His urologist is worried, discussing procedures and biopsies. Carlos feels confined. But everything changes when Carlos discovers that he must target all four of these forces simultaneously if he wants to help his prostate. Not a single one, each and every one. And that forbidden fruit enters the picture here. The one that exploded with juice and had hundreds of jewel-like seeds. The one that is currently being researched in labs worldwide and has been utilized for thousands of years in traditional medicine. A pomegranate. Punicalagins and ellagic acid are substances found in all pomegranates. These are some of nature's strongest antioxidants, stronger than blueberries, more concentrated than green tea, and more potent than red wine. Furthermore, these substances immediately start to act on inflammatory prostate tissue. They temper the fire raging inside your gland, stop inflammatory pathways, and decrease inflammatory chemicals. However, that is only the start. Additionally, pomegranate inhibits 5-alpha reductase, the enzyme that changes testosterone into DHT. Research indicates that pomegranate extract and juice dramatically lower the activity of this enzyme. Your prostate will receive less growth signal if you have less DHT. Without the sexual side effects, it has the same impact as those pharmaceutical drugs. There's more. There are anti-estrogenic properties in pomegranates. It lessens that dominant issue by blocking your prostate's estrogen receptors. It facilitates the more effective breakdown and removal of excess estrogen by your liver. It lowers blood sugar, reduces metabolic inflammation, and increases insulin sensitivity. And here's something that many guys notice right away. Pomegranates increase nitric oxide, a chemical that relaxes blood arteries, which enhances blood flow. Improved blood flow results in reduced inflammation, improved oxygenation of the prostate tissue, and, as a bonus, improved erectile function. Yes, you can improve your performance by doing the same thing that improves your prostate. Every morning, Robert began to consume half of a fresh pomegranate. On days when fresh fruit was not available, he took capsules of pomegranate extract. He went from waking up 4 times to 3 times in a span of 2 weeks, down to twice in a month. He only woke up once on some nights when he was 2 months old. His stream grew more powerful. He had the impression that he was truly voiding his bladder. His life changed for the better. Indeed, he also observed an improvement in his erections. Everything was interconnected. I understand your thoughts now. Pomegranates include sugar, don't they? That will raise my blood sugar, won't it? A whole pomegranate has roughly 25 to 30 grams of carbs. Thus, the answer is yes. Pomegranates do contain natural sugar. The important thing to remember is that the same polyphenols, particularly the punicalagins, actually reduce the rate at which sugar is absorbed in your intestines. The enzymes that break down carbs are partially blocked by them. Therefore, even though pomegranates contain sugar, it absorbs gradually. It doesn't have the same effect on your bloodstream as commercial juice or drink. And that slight gradual rise in blood sugar is greatly outweighed by the hormonal and anti-inflammatory advantages. However, you must properly ingest it. Purchasing commercial pomegranate juice that has been pasteurized, contains extra sugar, or is combined with inexpensive apple or grape juice is the incorrect approach. You won't benefit from that. That's basically pomegranate labeled sugar water. There are 3 alternatives for the appropriate way. Eat the fresh fruit first. Purchase a whole pomegranate. Open it. Extract the ruby red seeds and consume them. Daily half pomegranate, ideally in the morning. You're getting the entire range of chemicals from the seeds, and their fiber further inhibits the absorption of sugar. Second, prepare your own fresh juice. Drink 150 to 200 milliliters in the morning after removing the seeds, blending them with a little water, and straining off the pulp but leaving the thick fiber in place. Fresh, sugar-free, and not pasteurized. The third and most potent approach is to consume capsules of pomegranate extract. These polyphenols are concentrated in the extract without the use of sugar. Find a supplement that is standardized to contain 40% punicalagins or elagitanins. The usual dosage is 500 to 1000 milligrams per day. You get the most out of this without having to worry about sugar at all. The 65-year-old Thomas was dubious. He had previously taken vitamins that had no effect. However, he chose to combine methods, using extract capsules on some days and fresh pomegranates 3 times a week. He also made additional adjustments because, let's face it, pomegranates by themselves are insufficient. Your prostate won't get much better if you merely take pomegranates and continue to consume sugar all day, drink beer every night, and sit still for hours on end. You must take a comprehensive approach. First, cut back on or completely avoid sugar and refined carbs. Not a soda, no store-bought juice, not a single pastry, no sweets. Insulin is raised by sugar, and elevated insulin causes the prostate to enlarge. Additionally, sugar causes inflammation all across your body. Make this adjustment if you can only make one. The second modification is to do away with refined vegetable oils, such as canola, corn, and soybean oils. Many of these oils include estrogenic chemicals that exacerbate your estrogen dominance, and they are rich in omega-6 fats that increase inflammation. Instead, use coconut oil, avocado oil, or extra virgin olive oil. They are anti-inflammatory fats. Eating more fatty fish is the third alteration. Sardines, mackerel, and salmon. Omega-3 fatty acids, EPA and DHA, which are abundant in these fish, have remarkable anti-prostate inflammatory properties. According to studies, men who consume more omega-3 fatty acids are less likely to develop prostate cancer and expand their prostates. Eat 2 or 3 portions of fatty fish each week, or take a high-quality fish oil supplement if you are unable to do so. Consume cruciferous veggies as the fourth modification. Brussels sprouts, cabbage, cauliflower, kale, and broccoli. Sulforaphane and indole 3-carbinol, which are found in these vegetables, aid in the liver's metabolism of estrogens. Recall that one of the factors for your prostate to expand is estrogen dominance. Consuming cruciferous vegetables aids in the removal of excess estrogens. If at all possible, 1 or 2 portions each day. Change number 5. Consume pumpkin seeds. Prostate health benefits are unique to pumpkin seeds. Because the prostate concentrates zinc more than any other tissue in your body, their presence is crucial. Your prostate swells more readily if you are zinc deficient. Additionally, phytosterols included in pumpkin seeds have direct anti-inflammatory effects on prostate tissue and prevent testosterone from being converted to DHT. Pumpkin seeds, either raw or lightly roasted, once a day. No salt required. Drink green tea for your 6th change. EGCG, a substance found in green tea, has strong anti-inflammatory properties that are especially beneficial to the prostate. Green tea has been shown in studies to alleviate urinary symptoms and decrease prostate development. 2 or 3 cups per day, but avoid drinking them after 3 p.m. as the caffeine can interfere with your sleep. Reduce belly fat as the 7th alteration. Your prostate grows larger the more estrogen you generate, the more aromatase enzyme you have, and the more belly fat you carry. Additionally, insulin resistance brought on by belly fat encourages the growth of the prostate. Your prostate symptoms can significantly improve if you lose even 10 or 15 pounds of belly fat. Everything I've already said. Less sugar, fewer processed carbohydrates, more protein, more vegetables, and more exercise is the key to losing that fat. In relation to movement, the seventh modification is to move daily. Your prostate suffers greatly from sitting all day. Your prostate is compressed by sedentary activity, which also lowers blood flow and exacerbates congestion. Every day, walking for 30 to 40 minutes significantly reduces discomfort. Even better if you can perform resistance exercises such as deadlifts, squats, and lower body exercises. This lessens prostate congestion and enhances pelvic circulation. Reducing or eliminating alcohol is the ninth change. Alcohol affects your prostate in a number of ways. It encourages inflammation. Alcohol is converted by your liver into substances that have estrogenic properties. Alcohol disrupts the metabolism of zinc. Additionally, hops in beer specifically produce phytoestrogens that raise estrogen levels. Your prostate is continuously receiving estrogen if you consume beer every day. Avoid beer in particular and limit your alcohol intake to once or twice a week if you truly want to improve your prostate. The 10th modification is stress management. Prolonged stress maintains your cortisol levels high, and higher cortisol worsens prostate symptoms, reduces testosterone, and promotes inflammation. You require stress reduction strategies, such as meditation, deep breathing, taking nature walks, and engaging in enjoyable hobbies. Conscious calmness for 10 or 15 minutes a day makes a difference. Everything was put into action by Carlos, that 70-year-old man with high blood pressure and diabetes. Pomegranate every day. Capsules of pomegranate extract. Sugar was totally eliminated. Fatty fish was consumed 3 times a week. Took pills containing omega-3 fatty acids, taking pygium and saw palmetto, which are herbal supplements that promote prostate health. In 3 months, he shed 20 pounds. He had a smaller prostate. He lost his PSA. His symptoms related to his urine greatly alleviated. His urologist couldn't believe it. He felt like a different person, and his blood pressure and blood sugar levels improved. Not because of a single magic solution, but rather because he recognized the causes of his prostate's problems and took care of them all. Let me tell you about 72-year-old William. For years, William had been in pain. He woke up 5 or 6 times a night, ruining his sleep. He was worn out all day. He became irate with his grandchildren. His spouse was concerned about him. He was no longer able to drive great distances, unable to appreciate movies, unable to travel. His body seemed like a prison to him. His physician recommended surgery, namely a TURP treatment in which prostate tissue is cut out. William felt frightened. He chose to start with the natural method. Every morning he consumed pomegranate seeds blended with pumpkin seeds in his yogurt. He supplemented with zinc, vitamin D, lycopene, saw palmetto, pygium, and beta-sitosterol. He eliminated all refined carbohydrates and sweets. Ceased consuming beer. Began going for an hour-long stroll each morning. In 4 months, I lost 25 pounds. Week by week, his symptoms gradually got better. As little as 3 times every night, then twice, then once a few fortunate evenings. His stream grew more powerful. Once more, he felt alive. He called off the procedure. His physician was incredulous. William was aware, though, that he had provided his body with the means to recover on its own. Your prostate isn't lying to you, you see. You have been sending signals to your prostate for years, and it is reacting. Signs of elevated blood sugar levels, persistent inflammation, unhealthy fats, sedentary lifestyle, uncontrolled tension, preponderance of estrogen. However your prostate reacts when you start giving it the correct signals, such as when you consume anti-inflammatory fats, cut back on sweets, move, or give it pomegranates with their anti-inflammatory polyphenols. The irritation subsides. The symptoms get better. Your life gets better. There's more to the pomegranate you're going to purchase at the market tomorrow than just fruit. It's a prostate medication. It has been used for centuries and is now supported by contemporary science. It's a natural, cost-effective, and side-effect-free instrument that's right at your fingertips. However, a comprehensive approach is the most effective way to use it. Reduced DHT decreased inflammation, improved insulin sensitivity, and decreased estrogen are all things your prostate needs. Give it everything you've got and see what happens. Some men now inquire as to the distinction between prostate cancer and benign prostatic hyperplasia. The conditions are distinct. BPH is not cancer. It is a benign development. However, BPH-causing variables, particularly insulin resistance, estrogen dominance, and inflammation, also raise the risk of cancer. By using these techniques to improve your BPH, you can lower your risk of developing cancer. This is why it's crucial to address the underlying causes rather than only treating the symptoms with medication. In relation to cancer, I should also bring up PSA, or prostate-specific antigen. Your prostate makes this protein. An increase in it may be a sign of malignancy, prostatitis, inflammation, or BPH. Although it's not ideal, the marker is helpful. You should get investigated if your PSA keeps rising. The fascinating thing is that if your PSA is elevated due to inflammation, the same techniques I'm providing you for BPH also lower it. Studies have explicitly demonstrated that pomegranate lowers PSA in males with early-stage prostate cancer. As a result, it benefits both indicators and symptoms.